Hi, Ruth McLeod. Tonight we're going to talk about something that we do not get praised enough, nearly enough, and that is about advocacy, the art of saying something. Listen, when no one else hears, the nurse hears. When no one else sees, the nurse sees. And it is our role, our job, our duty to stand between our patients and harm. Bam, like a flippin' warrior, that's what we are. So, what is advocacy? Advocacy is about speaking up, about saying this is not right. We all know the moment a doctor is distracted, a family is unsure, a chart does not reflect what we see. We all know that moment. And sometimes you just have to stand up and say, hold up. But advocacy is not about being loud. I know I've tried the loud things. It doesn't exactly go your way. It is about being clear. It is about being flippin' crystal clear and not budging. Many years ago, I work as an advocate every now and again. And what I do is make sure that people understand what they are being told. Several years ago, I had a young woman who was at the end of her life with hospice, and I was in there as her advocate. And one day, the doctor showed up, and within 7 minutes, no lie, exactly 7 minutes, he basically told her she had 3 months to live, gave a bunch of jargon, and out the door he walked. 7 minutes to walk in and tell a 30-something-year-old lady that she was dying. So I was even a little bit stunned, and that doctor was gone. Like when I walked out in the hallway, he was just gone. There was no wrangling him back in the room. So I took both the husband and the patient, and I said, tell me exactly what you heard right then. And without fail, they both heard different things. That's the one thing. And they both heard the worst case scenario. They didn't even hear anything else that doctor said. And so in that case, my job of advocacy wasn't bringing that doctor in here and saying, hey, what in the world, that was ridiculous. But it was about making sure that my patients absolutely understood what was said to them. These people are being told stuff in a different language, and they are being told to make life and death decisions in a language that they do not understand. And so sometimes it's just about making sure that your patients heard you. Look, this is standing in the gap. That's what this is. It's standing in the gap between the system and the soul. It's standing in the gap between what is convenient and what is right. Be an advocate. Your patient needs it. They depend that somebody there is going to advocate for them because they may not have anybody else to do so. So make it you. As always, share this if you need it. Tell me a situation where you had to advocate. And you guys take care. See you in a few days. I have some really good guests this week. So tune in. All right. Honor of Nursing. Bye.